One of the groups keen to get a better handle on what the budget means for it is AIDS Saskatoon. Jason Mercredi is the executive director, and he joins me in Saskatoon tonight. Jason, AIDS Saskatoon is already dealing with funding being cut this year by various levels of government. What are you expecting from next week's provincial budget?
We're expecting the province to do what they've continually done, which is fund nonprofits at an adequate level. They have a very good funding model that they use, which is they fund nonprofits usually for multi-year agreements so that they can measure trends and then also get some pretty solid measurables out of there and then make programming decisions based on that, and we don't expect any different.
So what is your budget, and tell me briefly about the programs that it provides for?
The provincial budget provides for us?
Yeah, what is the money that you get from the province?
The province funds our support services department. That department does a lot of the heavy lifting for engaging the hardest to reach in the province in terms of intravenous drug users, homeless, hard to house, mental health and addictions. Clearly, that department does a lot of engagement with them, and then a lot of advocacy and health navigation services. On top of that, we do a lot of trends. We monitor a lot of trends and then report that up to right from the region to the province and then sometimes to the feds as well.
How do you navigate changes in funding when you've already had this $200,000 less funding this year from another separate cut? So how are you able to do the work of AIDS Saskatoon with less money? It seems the need is steady and even at times increasing.
Yeah, we've seen a demand for our services grow year over year for the past 5 years. Like I said, we're not expecting anything from the provincial level, but the federal government has cut us and 33% of AIDS service organizations across the country. That funding cut is definitely going to hit us. We've been told that we have funding for the next year, but after that we are definitely going to be in. We're definitely going to have to reevaluate for the following fiscal year based on the federal funding cuts.
Where does that reevaluation leave you? What do you think you need to look at as far as making it work on less money?
Well, we definitely have a committed group of staff and volunteers. However we deal with it, it'll have to be creative, and we don't know right now, so we can't make any declarations or promises, but we are committed to the work, and we'll have to come up with some game plans and probably get pretty creative in terms of how we deliver on programs.
Why is the work that you and AIDS Saskatoon do so important? Tell me about the larger value and the impact of putting money into groups like yours.
Well, we do holistic care, and so we don't just help people connect to health services, although that is a huge portion of what we do. We also do a lot of mental health work with them. We also do a lot of disability advocacy for them. We keep them engaged in healthcare and social services in the province. We have programming that goes into the hospital, and what they do is they help make sure that people don't leave against medical advice. And every time somebody does leave against medical advice, you see the cost skyrocket in terms of readmittance and having to go on different, more intense medication regimens, maybe dropping their antiretroviral therapy, then having to pick it back up. Every time they do that, they become med-resistant to that particular type of medication. And so we work very diligently to make sure that people stay engaged, and the way that we do that is by meeting them where they are at.
Thanks for your time today, Jason. I appreciate it.
You're very welcome.